Hi, my name is Babette Cooper. I want to talk to you today about health care in the United States. Would it surprise you to know that you live in one of the wealthiest countries in the world and that you may not have access to health care? America's health care system is changing dramatically. Some of the changes that are occurring because of our health care systems are due to the changes in law, the shortage of primary care physicians, and our growing elderly population. The Health Care Reform Act was signed into law in 2010. It is intended to increase the quality of care, the availability of care, and the cost. Some of the requirements that the law has made is that it ensures that insurance companies cannot refuse coverage due to pre-existing conditions. It also places a cap on the maximums allowed out of pocket for individuals. It also helps that they cannot cap the amount that they would pay for any condition that you may have. One of the other major changes that the Health Care Reform Act instituted was the Health Care Exchange. This is where people can buy insurance at affordable premiums. Individuals are not allowed to charge co-pays or deductibles for preventive basic health care. The shortage of primary care physicians in the United States is steadily increasing. Primary care physicians provide most of the care for the general population, especially our elderly, due to the fact that we don't have gerontologists. Approximately 1/2 of the nation's primary care physicians are over 50 and their retirement is looming. Primary care physicians have an increased patient load due to the amount of Americans with insurance. The law instituted gave 32 million additional Americans insurance coverage. Medicare has cut reimbursement rates by 20%, causing financial problems for some physicians' offices. In Columbus, we have 273 primary care family practice physicians. More than 1/4 of those are not accepting new patients at this time. This amount may not seem significant, but if that number continues to increase, we may not have ability to receive health care. The shortage of physicians is expected to steadily increase. By the year of 2020, we are expected to need an additional 45,000 primary care physicians in the United States. You may ask why this is important and who this would affect most. This will affect our elderly population, those 65 and older, because they require more medical care due to pre-existing chronic conditions. Our elderly population is expected to double. From 1998, we had approximately 34 million. In 2030, we are expected to have 69 million. Dr. Broder, a physician from South Carolina, in a recent interview stated that he had to close his practice due to cuts in health reimbursement rates. That left over 5,000 patients without a primary care physician. The changes in law, shortage of primary care physicians, and our growing elderly population is impacting health care. This is a concern for us all. We all want to have the accessibility of health care. We as a nation are growing to meet. And how are we going to meet these challenges? As Abraham Lincoln once stated, we have to act anew and think anew.